philosophy, which is Kaizen. And so Kaizen basically means change better. And so you should have continuous improvement, everybody, every day, everywhere. Just try to be 1% better from what you were like yesterday. So learning objectives would be to define QI, identify and explain various quality improvement methodologies, define a SMART aim, which is kind of like similar to how you would define your hypothesis in the beginning of a research. And then also list and describe the 7 key quality improvement tools. And we will identify our 3 types of measures in quality improvement and differentiate between different common cause and the special cause variation, as well as we're going to do a very fun process map exercise. Hopefully we will have time for that. So for all of you, please open your phones and see if you can log into this QR code and see, before I take it off, see if you can just log it, right? And I'm going to go here. So do you see the question? Everybody, let me see if it works on my end. Awesome. So we're getting to the results. Okay. That was the testing. Okay. So a lot more for coffee. Okay. That's interesting. Everybody done? Okay. Tea, you can do better. Okay. No? 7. Okay. That's 7. 8. Okay. So 16 to 18. Okay, great. So a lot more coffee drinkers than tea. Next one, let's see if you can have, hopefully the second question would also work. See if that works for you guys, or it's going to take you back to the first question, because that's sometimes what Mentimeters does. Oh, it's taking you to this question. That's really good. Hello, bye, hi. Okay. Alive, that's good. It's better to be alive. Great, good, hello. Okay, so that's a word cloud, as you can see. Tired, I know residency is tiring, but thank you so much for coming. Me, oh no, hungry, yes, please have your food. Worn out, it's been a rough day, I understand. So hopefully, like I said, it's not gonna be a boring dead no. Okay, coffee and tea, yeah, that's always good. Okay, so let me do one more, I think, slide, and then we'll be done for that. Let's see if that works for you now. Okay, hopefully it opens and goes on this slide. Innovation, right? Better? Good. Improvement, change. Confusing, yeah, you're right. It could be confusing. Project, change, better. Patient, yes, patient-centered, very good. Creativity, very nice. Confusing, I already, okay. PDSA, that's really great. You're already ahead of the game, whoever said PDSA. Work, collaborating, yes. Creativity, improving processes, awesome. So you guys already know about quality. That makes my life so easy. Great. So let's go and let's see if I can do that. Okay, so the definition of quality, everything starts with the quality, the extent to which the healthcare services provided to the individuals and the patient population, they improve. So the word is improve your desired health outcomes, right? And in order to achieve this, healthcare must be safe, effective, timely, equitable, and patient-centered. So you can see some of the words that you've already used in your word cloud. We really want that to be involved for the QI, right? So basically it goes from the Institute of Medicine, which is now called the National Academy of Medicine. And any project that you do, make sure it has one or the other component involved in it. Should be safe, timely, efficient, effective, equitable, and patient-centered. And like I said, most of you are already ahead of the game because you're already thinking of those things when you think of quality, right? So each system is perfectly designed to give you exactly what you are getting today, which basically means unless and until you change the system, you're not going to change the process, right? So whatever your processes are, your results are based on those processes. If you really want to change, improve the system, you have to change the system. So just a few not boring sessions, but few introductions to some of these great grandfathers of PDSA as well as Shewhart chart. So Walter Shewhart was an engineer and a statistician, and he used to work for the Bell Telephone Company. And he really was given a chance to work on decreasing the variation in the quality for the voice control. And that's how the whole process of Shewhart's control charts as well as Shewhart's PDSA cycle. So someone did PDSA. PDSA stands for Plan, Do, Study, and Act. So that cycle really originated. So he's considered as the godfather for Shewhart chart or for PDSA and quality improvement. Another name that you need to know is Deming. Edward Deming, he was also an industrial engineer and economist, and a lot of QI things are based on manufacturing companies. So you will hear a lot of like a Japanese methodology or like innovations that are related to manufacturing companies. And he told about these profound knowledge of system variation knowledge and psychology. So psychology, whenever you want to improve something in a system, how humans behave, right? So if you want to increase, or if you want to increase the turnaround time for the operating room, something has to be changed in the process, right? So what would be the effect of the staff when you implement something? The humans have to go through a change process, right? So he studied a lot of those things, and he spoke about the 14 points of organizational improvement, which are not going to go into detail. But I have a quick question. Why do we do the quality improvement project? So I've listed these three things: research, judgment, improvement. Can anybody give an example of why we do a QI project related to research? Anybody? Any example of QI related to research? And I know everyone's eating, so whoever doesn't have a bite. Okay, so I'll set the thing. So whenever you're doing something for a QI for research, you're adding the knowledge to the research and the literature, right? So something that you did intuitively that worked for you in your clinic, in your organization, or in your hospital, and then you wanted to share that information to the general population. The same concept of scholarly activity. So you want to share the knowledge and see how the generalizability worked, right? That's the QI for research. How the QI is done for judgment is mostly it's done in the organization when they're trying to see your red, yellow, and green metrics. You're not there yet because you're still in training. But once you graduate, many of the metrics are based on red, yellow, and green, which really is not the QI methodology. And the last and the most important is improvement of the process. So if you are a resident and you want to go find the instruments or equipments that you need for a procedure, and you have to go in 5 different directions and waste time, one of you might say, okay, how can we make it efficient? And how can we stock all of those equipments in one place so that next time when I'm doing a procedure, it's basically in a kit, right? So that is improving your efficiency of the process. And so Robert Lloyd, who is the pioneer in Institute of Healthcare Improvement, he came up with this very nice slide of 3 phases of performance measurements and research, right? So I want to differentiate between QI and the basic research that you do. So QI, your hypothesis is fluid, it's dynamic, right? It's a PDSA cycle. So you can say, I want to lose my weight, but I want to lose it by just doing exercise, right? And then 3 months into it, you're like, okay, I did like so much exercise, nothing worked, right? So your hypothesis may change. You can say, maybe I can add some of like calorie restriction to it, right? You change another intervention into your hypothesis, right? But in your research, you begin with a fixed hypothesis. You already have a fixed sample size. You've done your calculation for the sampling, and you're not changing your hypothesis from a randomized double-blinded control study, having a control group versus not control group, right? So that's the major difference between your hypothesis. So QI is fluid. In basic research, is a fixed hypothesis. Also, the analysis is different. So in your traditional research, you do chi-square, you do regressions, but in your QI, we do something which is called a statistical process control. It's called SPC analysis. It's kind of the same as your data over time. So if you have, some of you must have done your QI projects, you may have plotted the data over time to see how your data changes, increases, or decreases. And that's pretty much the methodology of statistical process control. And it is based on statistical equations, pretty much the same like how you have the bell curve for, 3 standard deviation above mean, or here in QI, we say 3-6 sigma. Okay, so we use the 6 sigma. The traditional research is standard deviation. So inspection with the aim of finding the bad ones and throwing them out is too late, ineffective, and costly. Quality comes not from inspection, but from improvement of the process. Again, going back to the manufacturing industry, right? So imagine if a big manufacturing industry is just relying on quality assurance after they have made all the defective pieces. That is a lot of waste, right? So they need a process to pick it before they have done the creation of those defective pieces so they don't lose the money, right? So inspection pretty much comes late. You need to have the process that is done earlier on, right? Pretty much the same methodology. Like people tell you want to improve your process and they're like, no, I want to have status quo because that's working for me, right? But they don't see the innovation that can get into there and make their life a little easy. Again, we're not going into that. This is really important, and I want you guys to know different organizations use different kinds of quality methodologies. And so the Institute of Healthcare Improvement, which is a pioneer for healthcare improvement, uses what is called the model for improvement. And that is where one of you or two of you mentioned the PDSA cycle. So that comes from Plan, Do, Study, Act. But the methodology is pretty much the same. You start off with a problem. So what is your problem that you're trying to achieve, right? How best you will know that a change is an improvement, and what are the changes that you can do to make those improvements, right? And on your left side, you have the 6 sigma, and the middle is the lean. Again, we're not going into detail of this different methodologies. I think you should just focus on the IHI, model of improvement, because this really lays the foundation for any QI projects that you're going to do for your research. This is the methodology which is based on the IHI, but comes from Harvard Medical School. And so basically they use, it's a 7-step process. You define your problem. So my problem is that I am gaining weight, right? That is your problem. Idea is a process. I need to know what are the reasons why I am gaining weight. QI tools, how you can utilize those QI tools to track your data, maybe do your measurements of your weight over a period of time, change ideas, what you want to implement, exercise, caloric restriction, or any modifications. And then you analyze it, and then you implement it and see whether it works or it does not work, right? So starts off with your problem, which gives you a SMART aim, and I will just briefly talk about that in a minute. You use your quality improvement tools. Measures are very important. Your definition, your data collection, analyze, and then your PDSA cycle. So aim statement, just like how you do your hypothesis, we start off with the aim in QI, right? So the aim is what is the problem you're trying to achieve, how good, by when. So any one of you have done a QI so far? Yeah, I see a nod. So what is the aim or the SMART aim for your QI? Anyone? Brave one? I see a nod, so I'm going to get you because I just saw you nodding. The one with the black scrubs. So what was your SMART aim? How good, by when? So how good, what percentage of the patient discharged did you want them to have an appointment with the PCP before they get discharged? And by when? Right. But all the patients, so everybody discharged should have a PCP appointment? Right. And by when? So how much time did you give yourself? 12 months, 6 months? Right. So always have like a time duration, right? So just to give you an example, I want to vaccinate everybody, right? That's not a SMART aim, right? Because that's not realistic. That's not possible. That's not measurable, and that's not attainable, right? So you should come up with how good, by when. So how much you want to vaccinate. Maybe I want to vaccinate 50% of the population who comes to my clinic, and my baseline was like 10%. So I'm improving like those 40%. By when? By 12 months. So like you said, right? So again, aim has to be SMART. So SMART stands for specific, measurable, attainable, realistic, and timely. You need to have some kind of a realistic aim. And so again, I'm giving a very easy example, lose weight. I want to lose 10 pounds in the next 10 weeks. Is that a SMART aim? Is that specific? It is specific, right? Because I want to lose weight, right? Is it measurable? It's pounds, so it's measurable. Is it attainable and realistic? I think it is, right? 1 pound, maybe a week, right? Is it timely? So it's 10 weeks, right? So it's timely. So that's SMART aim. Now CDC comes up with something called a SMARTY aim or SMARTY objective. So it has all the components of your SMART, which is specific, measurable, achievable, timely, but also inclusion and equity. And so we're going to do a quick exercise. My aim is that I want to decrease the rate of breast cancer mortality. Is that a SMART aim? Okay. I see a lot of no's, right? It's not a SMART aim. Why is it not a SMART aim? It's not measurable, right? Not timeline. I don't even know by like next month, next year, in 3 years, right? So we do not have any specific timeline, and we don't know, it's not measurable. So SMART aim, decrease the rate of breast cancer mortality among women from 40 to 35 by June 2025. Is that a SMART aim? Yeah. It's not. Why? So from 40 to 35, it's 5%. So it's kind of like attainable, right? By June 2025, it was like an old version because June is already gone, right? So I don't know how much time I gave myself. So kind of towards the SMART aim, but you can say 12 months, 24 months to make it more smart, right? SMARTY aim would be decrease the rate of breast cancer mortality from 40 to 35 among African American women by June 2025, right? So that will be a specific population that you're targeting. So you can target your, like how one of the residents had the patients who received IV antibiotics. So you don't care about everybody else who's discharged, but patients who receive IV antibiotics, that's your population, right? So that's that's kind of like a SMARTY aim because that's your specific population. These are the 7 QI tools. Some of these you may have seen it around, I'm pretty sure, in some of the papers that you have read or some of the statistics that you have done. So we have the process flow map that we're going to do a quick exercise. We have something which looks like a skeleton of a fish, and so the name is fishbone. So it's easy to remember. Fishbone diagram. Then you have run and control chart, which is basically data over time. So just like how you do your data over time, you plot what it was yesterday, what is it today, what's going to be tomorrow. That's the data over time. And then you have the checklist and the Pareto chart, which we will briefly talk. If you can't describe what you're doing as a process, you don't know what you're doing. And so I really want all of you guys to at least know how to create a process map. Or when someone tells you, what's the process in your clinic? Or what's the process of discharge? I really want you guys to know how to describe your process, right? So that's the best thing I think you can get out of it today. So it's very easy. IHI has like a very nice cheat sheet. So you all have it, and I gave you like a blank paper too. Juliet was so nice to have it printed for you guys. So the oval is the start of a process, okay? The square is the activity or like your next step. And then your diamond is your decision point, and the flow line is 9, right? So just to give you an example, I go to bed, I go to sleep, alarm goes off. My decision point, is this a on-call day or is this not an on-call day, right? So then if it's not an on-call day, you're like, why did I even wake up, right? And if it's an on-call day, you get up and you get ready, right? So you see how your process is. The end should also be an oval. It should not be it's a rectangle, but it starts with an oval, ends with an oval, and you have different steps in between, right? And I think IHI has like a little format on MI. So you will see how that works in the professional field projects as well, right? So you get up and that has to be like an oval. So I actually, my hometown, I'm from Northeast. I just came here 2 years ago. I've spent some time in Hershey, which is the sweetest place on earth. And so Hershey is a chocolate factory, right? It is a manufacturing company. So I was like into QI too much. So everything looks like QI, right? So I went to this nice chocolate tour, which is like in the chocolate world. And I do see their process map. So can you imagine, like everything has a process map. So you can see, and they actually take you to like different steps of the processing of the chocolate manufacturing. So it is like, they have the seeding, they have the bean blending, they have roasting, they have breaking, they have milling, they have central blending, drying, refining, tempering. And in the end, you get the sweetest Hershey chocolate, right? So everything has a step. And that is what is meant when someone asks you, what is the process? They really want to know what the steps are. So if I ask you, what's the process of the patient check-in? Then you should start, patient comes in, goes to the registrar person registers them in, gets them in an inbox, and then gets to the MA, and then gets to the physician. So really they're trying to get to know what are the steps involved, right? And that's very important whenever you want to do any QI project. So how we extrapolate it into our medical knowledge or our QI project, this is one of the projects that I did with family medicine residents. We were trying to enhance their procedure clinic. So we were like, okay, what's the process currently? Why are the residents not getting a lot of procedures in the clinic? So how do they get registered? So you have to talk to all the stakeholders. You have to talk to everybody. And so we did like a stakeholder analysis, and we figured out that people at the front desk, they did not even know that the family medicine resident can do a pap smear. They didn't know the family medicine resident can inject the steroid. So what they were trying to do is that they were referring those patients out to subspecialists. And the subspecialists were not in the same clinic. It was like 40 minutes drive for the patient. So what would happen? The patient would be lost to follow up, right? Patient's not going to come back to you. The resident's missing the training and the procedure. And so you really have to dig down deep into the problem. And so we figured out there are a lot of things that we can refine. Some of the physicians were also uncomfortable in doing those procedures. So we were like, okay, how we can improve it? We did a fishbone exercise. The head of the fishbone is actually your problem. And then you're trying to figure out what are the causes of the problem. And then we figured out we're not having the outpatient procedural training for our family medicine resident. And we figured out there's so many things that are happening on the way. So I marked it in red, right? So the residents are not confident. They're missing out on some of these procedures going out of your, clinic. And then also some of the physicians are not really trained. So a lot of things that we can address, right? And so how do you decide? There's so many issues that you should address. How can you pick the important ones and make a difference? And so this is something which is called a Pareto principle, which is an 80-20 principle, which basically means that 80% of your problems are because of the 20% of the causes, which are called the vital few. So if I can address that 20%, I'm going to make a huge change, right? So if I would just train my residents to the front desk, I'm going to take care of 80% of the problem. So always look for the vital few, because really you're not going to have the resources, you're not going to have the budget, you're not going to have the time to address every single problem that is causing your, significant changes. So change ideas, you pick your changes. How do you measure, right? So just because you can measure everything, you don't have to measure everything. So it's very important to pick your measures before you're trying to do your QI project. And so there are three kind of measures, which is outcome measure, process measure, and balancing measures, right? But before you start any QI project, you have to have some of the measures. And so I'm just going to give you a brief example. OB. So I'm an OBGYN. Let's do that. Maternal mortality rate. That is your outcome measure, right? Neonatal mortality rate. That is your end outcome. So that's your outcome measure. Process measure would be the percentage given magnesium sulfate or antihypertensive within 30 minutes. And for emergency department, it works as time to antibiotics or door to balloon time for cardiology, right? So different methodologies. Or average length of stay is your throughput indicators, or percentage given antibiotics for pneumonia within 6 hours of admission. So anything that can increase the efficiency of your processes, you can determine whether it's an outcome measure, it's a process measure, or it's a balancing measure. Balancing measure is basically whenever you do something, you should anticipate something to go wrong, right? So whenever you initiate a process, one of the things that can happen is it's an extra work, right? So maybe the nursing staff not going to be happy with you. So staff satisfaction is your balancing measure. Or what if I want to enhance the vaccination? Some of the people will get side effects, right? So the balancing measure would be those side effects, right? How many of them will get like a bruise or like, edema? So those are the things. And just briefly on the type of variations, there are two kinds of variations: common cause variation and then the special cause variation. Just to give you an example, everyone's heart rate has a baseline variation, right? So our heart rate is not 70, 72 every single beat. right? So there are some variations. Now, if my heart rate increases to 110, I need to know why. Was I exercising? Was I in panic? Like the reason, right? So that's kind of like a special cause, because it's not normal to be just at a baseline of 110 for no good reason, right? So you need to define it as a special cause. Now, you may find the cause, you may not find the cause, but at least you're going to evaluate it, right? So that's the difference between common cause and the special cause variation. And of course, you have to get the data. And so just going over, I'm not going to train you on the run chart, control chart, because that is another master's, but this is a control chart. Okay, so any one of you, and I know that you don't have a baseline for the control chart, right? But anyone, volunteer, brave volunteer, is going to tell me what's happening in this graph. I did it with my third grader, so you guys can do it. I know you guys can do it. What's happening? Just look at it. Just look at the lines. What's happening to the lines? Yeah. Yeah. And then what's happening to it? They're decreasing. Yes. So there were a lot of number of open encounters, right? In the first phase, started to go down. And the last phase, it went so low. So you're the brave one. You're going to get a tumbler from me. Okay, here you go. You see, you did an amazing job, right? So something is up, something went down, and then something went really down, right? So that is what we're looking for, sustainability. You see all those dots at the end, they are staying down. They're not going back up, which means that whatever I implemented worked, right? It was not like a one-time thing. So something was really high. I started my intervention, and then it's sustained. That is really what a QI project has to look like, okay? And then you implement it, you can scale up, you can spread. We're not discussing those details. And then you share. Always try to share your results, because whatever you did in your clinic or in your hospital, someone else might be thinking to do the same thing. So share it so they can have some ideas and they can use those change ideas, right? And so again, going on the same example of the QI project, we wanted to increase the procedure training of our residents. Why we wanted to do that? Because that was a problem. It's an ACGME requirement, right? We use the model for improvement. We came up with our SMART aim. So it is timely. We wanted to increase the procedure from the baseline to 50% in 1 year, right? So it's timely, specific, measurable. You came up with your study design. It's a quasi-experimental ITS studies. You do your intervention, and then you pick your measures. Again, it's a multifaceted intervention, so you have different bundled interventions. So instead of saying, I just want to lose weight by doing exercise, I added, I'm going to lose weight by adding exercise, calorie count, God knows what not. So added 2-3 things in it, right? Measures, you have your measures. Again, process map, always come up with a process map. If you don't know the process map, you really don't know what's happening. Fishbone, this is a fancy swim lane process map, which showed that we did the improvement, right? So again, another brave one. So I'm going to ask this brave one to do these 4. Anybody? Somebody? I know you know it. Not the details, just like what you see. The brave one. You can do it. Okay, awesome.
So the top left one, it looks like after the intervention, it's increased.
Yes.
Whatever we're measuring. The top right one, it looks pretty similar, like there's just more variation.
Okay.
Bottom left one, it looks pretty similar pre and post. And bottom right one, also pretty similar. It's a little tighter on the top.
Are you talking about this P, the last one here?
Yeah, the last one.
Yeah, it's tighter. Yes, you're right. Okay, great. So you get another time. So this is great. That's a great one. See, that's what you get when you have, like, you don't have like a baseline of SPC, but you're good enough to share it. So you're absolutely right. So the first one is the number of resident procedures. They were low, went up, right? This one on this side is that the total number of procedures also went slightly up. And those were the procedures for the NP, because they thought maybe we're taking the NP procedures and giving it to the residents. And we were like, no, not really, because the NP's procedures had like a little decrease, but it was not statistically significant, right? So what we did was that we really increased the total number of procedures and giving the residents enhanced procedures, right? This is a chart which is called a P piece for proportion chart. So this takes into account your denominator, because every month the number of procedures is not the same. Every month the number of deliveries is not the same, right? So you want to watch the number with the total denominator. And so that also shows that it increased because your denominator increased, right? So this is like, a proportional chart. If you want to get a little fancy, for those of you who are on scholarly activity, for linear regression, went up, total procedure went up, non-resident procedures are not statistically significant, is 0.06, right? So how you present it, when you're going to present it as a poster, your poster presentation for QI has to have some of these components. Some of the QI forums like IHI would not accept your poster if you have a bar chart, if you have a pie chart, because they really want to get the data over time. So any one of you who wants to present your data into a QI as a poster or as an oral, make sure you have some of the SPC analysis and you have some of the fishbone and, the process map exercises in it. So this is how it looks like in a poster. This is how it looks like in another poster. So this is the one, and I actually have it printed out. This is my publication that just came out 4 days ago. We did the IV iron sucrose infusion to reduce the postpartum blood transfusion. So you can see anybody who has no information about this thing, something was too high and then went down, and over here something was low and then went up, right? So this thing that went up, this thing that went down. We're trying to do the same thing. We're trying to decrease the transfusion and increase the infusions, right, of the iron. Again, another project. This is how your posters should look like. Again, this is the one that I'm currently doing with my hospital, with one of my IM residents. And we figured out that a lot of VTE was because of the PICC line. So we did the Pareto exercise, and we figured out that a lot of the VTE that the hospital was getting was because of the PICC line. And so it was about 30%. And so you can see the pre-intervention data. And now we're working on a checklist for the interventional list, right? So this is being accepted at the IHI, which is again the Institute of Healthcare Improvement International Forum in December this year. And this is a first year IM resident. So, you can get into these projects and you can publish it and present it. It just needs like a little bit of refinement. So episiotomy proportion rate coming down, hypoglycemia. This is again, you see those exercises. Now, my basic aim of showing all of these things is that you're not going to get an expert on this. This is how you should aim for when you're going to present in a poster. This is how the reviewers look for the items in your poster or in your QI, right? So you should have the process maps, you should have the SPC, you should have a fishbone. And again, what is the ultimate outcome? You really want to increase the research and the literature, right? So you should publish it. And so this is the publication. Again, this is the recent one 4 days ago. And this was the one from, increasing the IV infusion and decreasing it. So again, it's a statistical process control, and it's very, this is really great. So I am really proud to say that I do have in my program, we're the only one in the nation that has a dedicated EQUIPS curriculum, which I coined. It's an equity, quality improvement, and patient safety curriculum. So all these things I teach my residents. So my interns, all 4 of them, I have 4 interns only. So all 4 of them, they have their projects accepted in IHI, and this is their 4th month. So, it starts really early on, because ultimately my aim is that by the time they're in their 3rd year, they should have published them. So it takes time because, you need to get the data and you need to do that. So we have 20 minutes and we're really on time. Let's practice our process map for morning coffee or tea. So 18 of you guys said that you like to drink coffee in the morning. And I think 8 of you guys wanted to have tea. So I want to see what your process is to make your morning beverage. So you do have your white blank paper, right? And then I can go over the the symbols again. So the oval is the start of a process, rectangle is the step in a process, your decision point is your diamond, and then you connect them with an arrow. So I want to see how you do that in a process map for your morning beverage. And I'll give you like 10 minutes, maybe like 12 minutes. Think about it. Or maybe you don't think it because you go to Starbucks and you just get the coffee. That's really great. Okay, I think we have, how are we guys doing? Anyone's done? Anyone's done? Awesome, we got a brave one. Okay. Can I come in there and see? Did you drive? Okay.
I guess the circle, the start is you wake, decide that you want tea.
Yes.
Next step is to boil water.
Yeah.
And then get a tea bag,
Mhm.
put a tea bag in a mug,
Mhm.
add the water,
Mhm.
add lemon,
Mhm.
add some sweetener. Let it seep 5 minutes, stir, and then ready to drink.
Awesome. So that is really great. That is really great. So give me a second with the brave ones. You get the special number. That is a very pretty sweet number. And that's the last one. So last one for the day.
Oh, wow. Oh, it is pretty.
It is pretty, right? Such a nice, pretty color. Okay,
Thank
great.
you.
You're most welcome. So now, let me share. Again, like I said, I'm a tea person too. And so I did this exercise. I hope the thing works. Let's see if the video works. Good morning. I will be going through the steps to create a process map. So on the screen, you can see I have opened the QI toolkit of flow chart from IHI. Just to go through the components of a process map. So you have oval, which is what shows the start and the end of a process. A rectangle shows the activity or a task. A diamond basically shows your decision point with a yes or a no. So there will be like two arrows going out of it. One is yes, one is no. And then the arrow is a flow line, which shows the direction of your process. So for example, they already showed an example of a flow chart where a patient has an acute symptom and goes to the ER for evaluation of MI. And so the start of a process, if patient has acute symptom, this should be actually an oval. And then the triage in the ER, there is evidence of MI, yes or no. If there is no evidence, then the patient gets the ambulatory care. If there is evidence of the evidence of MI, then there will be an early anti-ischemic infarction therapy, inpatient evaluation, and then there will be a decision point again for invasive evaluation done or not done. So if it's not done, there will be ambulatory care. If it's done, then whether the procedure is indicated or not. Again, you'll see there are two arrows, no, yes. It's a decision point. So then if the procedure is indicated, there will be revascularization procedure. So just like a basic step for a patient who goes for acute symptoms. Now, putting it on how to create it ourselves, I did, for example, I'll show you the process map for my preparation of morning tea. So I did this exercise. This is a process map for preparation of my morning tea. I created this in Lucid Map, which is a free website where you can create process maps, the basic process maps. And you can do it on Visio, you can do it on other websites, you can do it on Miro as well. And there are other like beautiful websites where you can create even nicer process maps. But this is just like a basic one. So my process starts basically when I wake up. So this is an oval. I wake up at 6:30. I get ready, and then I have a decision point whether my husband has left earlier for work than me. If he has, then I only have to make tea for one. But if he hasn't, then I have to make tea for two. And then I boil water and black tea. I add milk and boil, and then my tea is ready. And then I have another decision point whether the kids are awake or not. So if the kids did not wake up, I can have my hot tea and drink my tea. However, if the kids woke up before I could enjoy my tea, I have to give them breakfast first. And then in the meanwhile, my tea gets cold. I have to microwave it again, and then I drink my tea. So you see the end point is drinking tea finally. And so that is an oval too. How to put it in a PQI is, so I have a pre-intervention process map for a PQI. So the We're not doing the PQI because that is like, so PQI stand for Personal Quality Improvement Project. That is one of my projects that I do fun exercises with my residents as part of my Equips curriculum. So they pick anything in their life that they want to improve. They collect data over time. They come up with their own interventions, and then they see if that works or not. So my current first year, one of their, it's a PWQI. So one of their PWQI is he wants to decrease the commute time because it takes him too long to come to work. And so he's trying 2 different routes to see which one works better. He's going to plot the data over time and see which route he should take, right? So just something in his life, he just came up with it himself. And then other people, they're like, okay, I'm not sleeping better. I'm like, you know, so there are different kind of things that happening in your life that you want to improve for your own sake, to make it improvement in your own life, right? So that is a PWQI, but we're not talking about that right now. So that was, how was that? Let me go back on the last few slides. I think we were done with that. And so we're not doing the aim statement because we did the aim statement. Just these are my beautiful, beautiful Irish twins. They're 8 and 9. And so they learned research really at this age. You see the responsible conduct of research. That's when my daughter went to a master's class with me, because I took her with me for my first master's, which was a master's in public health sciences. So this is how old she was. And that's exactly the time when you should start studying research. But reach out to me. I know Juliet is going to have my email. I love to refine the QI projects. I really admire doing that. So just reach out if you have any questions, how to refine your aim statement, how to, refine doing your fishbone, how to pick up a forum or a conference where you want to present your QI, but you don't know how you want to refine it so that it can get accepted. If you really want help with statistical process control, I think I do have the skills to help you for that too. And I love doing that. So reach out anytime. Okay. And did we have another mentee? Let's see. I think I do have another mentee, so let's see if that works. What is your take home from the session today? I hope it goes on the right one. I think it's working. And I hope no one mentions boring, right? It's not boring. Okay, great. Organization smart, flow chart. Fishbone, yes. How do we contact you? Yes, that's a good question. Juliet is going to send, it's my first and last name, erum.azhar@commonspirit.org. Just reach out and we'll make sure that we send our contact. Useful, IHI, QI help. Yes, anytime, reach out to me, interactive. I love making it more interactive. Your feedback is important. I love doing that because that's, just like possible. It is possible. Yes, anything is possible. Aim, and it has to be a smart aim. Please make sure it's a smart aim. At least if it's not a smarty, at least keep it to smart, right? So you need to know how good, by when. Always have a timeline, and always have like how much do you want to decrease it, and don't give yourself like non-realistic percentages, right? So don't say I'm gonna make it 100% better. So say I want to do it like 10%, 20%, something which is more realistic, right? Process map, yeah, awesome. So thank you so much. It was a pleasure to be here, and we'll have my email. And then I guess you have like a survey or something.